Does eating dairy products make you feel bloated, give you belly pain with lots of gas and even diarrhea? If so, you may be lactose intolerant. And that's what today's video is on. Today I'm going to talk about what is lactose intolerance, what are the 3 different kinds of lactose intolerance, what are the symptoms of lactose intolerance, and most importantly, what can you do about it? Hi, I'm Dr. Brian. Lactose intolerance is a common digestive disorder, and it in fact affects millions of people worldwide. 65% of the entire world population is actually lactose intolerant. It occurs when the body is unable to fully digest lactose. And lactose is a sugar, or the main sugar found in milk and other dairy products. This condition can cause a wide range of uncomfortable symptoms, but most commonly these include bloating, diarrhea, abdominal pain shortly after consuming any type of dairy products. While lactose intolerance is not life-threatening, it can really significantly impact a person's quality of life, and particularly in Western cultures where dairy is a dietary staple. So what is lactose? Well, lactose is a disaccharide. That's a fancy name for a sugar that is composed of 2 smaller sugars. And in this case, lactose is made of glucose and galactose. But in order for your body to absorb lactose, your body must first break down the bond between these 2 simple sugars. This process is carried out by an enzyme called lactase, and this is produced in the little finger-like projections or villi of the small intestine. Without enough lactase, the enzyme to break down lactose cannot be properly digested, and it can't be absorbed. Instead, it passes through the small bowel into the colon undigested. Now remember, there are trillions of bacteria in the colon, and these bacteria act immediately upon the sugar, and it undergoes a process called fermentation. This causes a lot of the symptoms that are associated with lactose intolerance. Lactose intolerance can be classified really into 3 main types, each with different causes. Number 1 is primary lactose intolerance. This is by far the most common, and it's genetically determined because most people are actually born with the ability to produce lactase and break down or digest lactose. But this digestion occurs especially during infancy and early childhood and is probably related to breastfeeding. However, as many of these individuals age, the lactase production decreases in the intestine. This can then lead to lactose intolerance. This decline is particularly common in people of East Asian, African, and Mediterranean descent. The second kind of lactose intolerance is known as secondary lactose intolerance. This form occurs not from genetic reasons, but it's actually from injury or illness affecting the small intestine, and that causes a temporary reduction in lactase. Conditions that can cause this include celiac disease, Crohn's disease, chemotherapy, and especially simple gastroenteritis, the flu, so to speak. That can cause a significant reduction in the lactase that your intestine produces. In all of these cases, oftentimes treating the underlying condition will actually restore this enzyme level, and this will alleviate your symptoms of lactose intolerance. The third and most rare type of lactose intolerance is congenital lactose intolerance. This is an inherited form of lactose intolerance. Babies are born with it and they have it their entire life, and it's actually very rare, but they require a lactose-free diet from birth on. So what are the symptoms of lactose intolerance? Well, we've kind of touched on those, but why do they happen? The symptoms of lactose intolerance typically begin 30 minutes to 2 hours after consuming foods or drinks containing lactose, dairy products. The severity of the symptoms can really vary because people vary on how intolerant they are. Some people have a little bit of the enzyme, some people have no enzyme. Not all people are created equally in that manner. Common symptoms include bloating. This occurs because the undigested lactose ferments in the colon, producing gas. This not only makes you feel bloated because the intestines get larger from the gas, but you also may pass significant gas and have very severe flatulence. Another symptom is diarrhea. The same fermentation process that gives you gas will actually pull water into the colon from the surrounding blood vessels. This can lead to very loose stools and bad diarrhea. Abdominal pain and cramps, these result from this increased gas and the fluid we've already talked about. And it's very, very common to have nausea. Again, all the fluid, the diarrhea, the gas can really make individuals sick to their stomach. Some individuals, they tolerate small amounts of lactose without symptoms, while others may react to even the tiniest amounts of lactose. Diagnosing lactose intolerance typically involves a combination of clinical history, which may may confirm it without anything else or some additional laboratory tests. These include, first, the lactose tolerance test. This is looking at blood samples after you've been purposefully administered a dairy product that contains lactose. Second is actually the most commonly used test for diagnosing lactose intolerance, and that's known as the hydrogen breath test. That is done by, again, giving an individual lactose-containing dairy products and then evaluating their breath and looking for hydrogen, because elevated hydrogen levels indicate that that lactose is not being properly digested, has gone all the way to the colon, and is being fermented by bacteria in the colon, producing gas. There's also a stool test that's often used for infants and young children, but not often for others. The final test is a really very hands-on practical test, and it's called the elimination diet. Sometimes doctors may recommend an elimination diet where all lactose-containing foods are removed. You don't eat them, and you see if your symptoms improve. If they do go away, then you add lactose again, start eating dairy products. And if the symptoms come back, it's very likely that the reason is that you're lactose intolerant. So finally, and maybe most important for most of us, how do you manage lactose intolerance? There's no cure for lactose intolerance unless it's the secondary type where the intestines just gradually produce the enzyme again. But for most people, the condition can be effectively managed through dietary changes, and in some cases, supplements. There's a couple of key strategies. One, lactose-free and low lactose diets. There are a number of drinks and foods now available. Lactose-free alternatives are available in milk, yogurt, cheese, and there's also a number of plant-based milk alternatives. Almond milk, soy milk, oat milk, all of those are lactose-free. And then finally, there are lactase supplements, artificial enzymes. Over-the-counter lactase enzymes like lactate is a really popular one. If you take that right before you have dairy products, then you too can have ice cream again. That's lactose intolerance. If you have interest in other videos on your gut and your GI system, try these videos on your gut microbiome.